Magandang umaga, Filipinos. Good morning. You're watching Eagle News Mornings from Canada. I'm Thomas I. Likeness, reporting from our Eagle News studio in the Western Canadian province of Alberta. My city is Edmonton, and I'm here to bring you news and commentary from across the country. A good Monday morning to you. Hope all is going well as we begin another week. Let's check the weather this morning in Manila. AccuWeather forecasting a mostly cloudy, warm, and humid day. Chance of an afternoon thunder boomer there. A high today of 29 with a real feel of 35 and a 53% chance of precip and drip. Currently cloudy, 24 degrees, feels like 29, and the air quality rated as fair. We turn now to the weather map in Canada. Our street scene today comes from Pitt Meadows in British Columbia, and a big thank you to Jen De Leon for that shot. Starting on the west coast, we might call it the wet coast today. The west coast, Victoria, light rain and 7. Vancouver also had light rain, 6 degrees. Across the Rocky Mountains to Alberta, Edmonton is sunny and -8. Calgary, mist in the air, -8. In Saskatchewan, Regina reporting light snow, -8 degrees there. Light snow in Saskatoon, -10. Winnipeg has light snow and -7. Toronto, mostly cloudy and 0. The nation's capital, Ottawa, mostly cloudy and -4. And Montreal, partly cloudy and -4. The Atlantic provinces, well, we go to Fredericton. There's some sunshine there. Chilly, though, -3. Halifax, mainly sunny and 1. And St. John's, Newfoundland, mostly cloudy and 3 degrees. At the top of the news, public health officials on edge over new variants of the COVID-19 virus. As Eagle News correspondent Andre Lejoie reports, 2 such cases have been found in Ontario.
Dr. Shapriya Sharma, Chief Medical Advisor for Health Canada, said based on the current information and previous testing on coronavirus variant, she believes both the Pfizer and Moderna vaccine will be effective against the new COVID-19 variant discovered in UK and now 2 cases in Ontario, Canada, that was also discovered in confirmed case of coronavirus variant. The province's Associate Chief Medical Officer of Health, Dr. Barbara Heff, made the announcement in a news release. Officials said that the case involved a couple from Durham region, Ontario, with known travel history, exposure, or high-risk contact. Both are now in self-isolation. This further reinforced the need for Ontarians to stay home as much as possible and continue to follow public health advice, including the province-wide shutdown measures beginning today, says the Health Department. Durham Region Health Department has conducted a case and contact investigation. Ontario is working in collaboration with our federal counterpart at the Public Health Agency of Canada. The virus variant has already been found in many countries beyond UK, including Netherlands, Belgium, Denmark, and Australia, officials says. The Government of Canada and health officials are investigating the situation. Stay home, stay safe. Reporting from Ottawa, Canada, this is Andre Lajoie with Eagle News. We live in interesting time.
Now, I've just got an update on that story. The Ontario government reporting a 3rd case of the COVID variant. In a late afternoon news release, the province says this one involves a person who was recently in the UK. And it's situations like this that has prompted the Canadian government to bring additional travel restrictions in. Standing by live in Montreal to tell us about them, Eagle News correspondent Marjorie Quintos. Marjorie, good morning.
Good morning, Tom. So, Canada and the UK share a sovereign, Her Majesty Queen Elizabeth II, and are among the oldest parliamentary democracies in the world. These 2 countries work closely together in many international organizations, including NATO, the G7, the G20, and the Commonwealth. By geographical distance, it only takes 6.5 hours from London's Heathrow Airport to Montreal's Pierre Elliott Trudeau International Airport, allowing for affordable travels and layovers between both countries. However, due to the identification of the coronavirus variant in the UK, the Government of Canada has suspended entry into Canada of all commercial and private passenger flights from the United Kingdom until January 6, 2021 at 11:59 p.m. EST. The Public Health Agency of Canada is closely monitoring the situation and working with its international partners, including the WHO, to better understand its variant, its impacts, and the possibility of international spread. Since March of 2020, the Government of Canada has put in place an emergency order under the Quarantine Act that applies to all travelers arriving in Canada. Such emergency order requires persons entering Canada by air, land, or sea to isolate for 14 days if they have symptoms of COVID-19, or to quarantine for 14 days if they're asymptomatic to limit the spread of COVID-19. Compliance with this order is subject to verification and enforcement. Those in violation may face detention in a quarantine facility as well as fines and/or imprisonment. In Canada, this is Marjorie Quintos. We live in interesting times.
Marjorie, thanks for the report. Before you go, it's been a holiday weekend here. The Prime Minister, health ministers, public health officials, all of them have been telling us, stay home, no family dinners. Just from your general observations in Montreal, what's the situation been like there?
I see that it's not like I went out actually, but Montrealers have been compliant with the situation. Actually, I've heard a lot of gatherings that were planned but were canceled. So, there's really not much information about what's happening. No emergency or anything.
Yeah, generally in parts of Canada anyway, Canadians are compliant. Thanks again for joining us, Marjorie, and hope to see you again soon on the show. Now, as the story of the second variant plays out, people are asking, are the vaccines effective on this variant? Scientists at Moderna and Pfizer, well, they're busy trying to answer that question. They're optimistic the vaccine will be effective. Moderna says, though, it will begin testing against the new variant in a few weeks. Now, this is the time of year when I would like to escape the cold, the snow in Canada, vacation in a warm spot like, well, the Philippines. And I'm not alone in my desire to escape winter. Tens of thousands of other Canadians who are always looking for a warmer climate to vacation in the winter months. But not this year. Our Prime Minister Justin Trudeau says, forget about it this year.
The time for a vacation abroad. Even if you travel every winter, please rethink your plans. In many parts of the country, hospitals are already struggling to cope with new cases. There are new strains of this disease in places like the United Kingdom. The situation is very serious. By staying home, by following public health rules, you can be part of the solution.
Hopefully in 12 months, we can book those tickets for a great winter time in the Philippines. But this year, not a great time to travel or even be a travel agent. The phone definitely not ringing there. People are staying home either because of travel restrictions, but also the fear of getting infected at their destination. And of course, the cost of health care to take care of that. Coming up later in the program, I've got a story on the conditions in one of my other favorite destinations, Hawaii. Well, Canada's biggest province, Ontario, in a state of lockdown that went into effect Saturday. Premier Doug Ford brought in the measure to control an out-of-control spread of the coronavirus. All but essential businesses have been shuttered. Stores and restaurants will be allowed to offer curbside pickup. Capacity at retailers, well, they can only have 20%, 25% of the amount of customers normally allowed in. Restrictions will be eased in low infection areas on January 9th. Other parts of the province will have to wait until January 23rd. Now, the problem in Ontario and several other provinces is that a growing number of people who are infected end up in the hospital. This is putting a strain on the system. Treatment for other medical problems is being pushed aside. And the fear is if hospitals are pushed beyond their capacity, the next step, rationing of treatment. The rising case numbers also a reflection of people's behavior. It seems they're less concerned about following public health guidelines this time around than they were during the first wave in the spring. COVID fatigue has definitely set in. The second wave of the pandemic is turning into a rerun of what we saw in the spring, a disproportionate number of cases linked to nursing homes. The elderly, chronically ill, as well as those who care for them, well, they're among the hardest hit. One home in Calgary, more than 200 residents and staff members infected. 16 of them didn't make it. In Ontario, more than a quarter of all of the province's nursing homes reporting outbreaks. That's more than 160 of them. This is happening despite promises from the government to fix what has been termed a broken system that cares for our seniors. Maybe it's time to do like they did in the spring. Bring in the military again to help out in these homes. A prisoners' advisory group says inmates should be given priority for the COVID-19 vaccine. The John Howard Society made the call in a tweet earlier this month. It poses an ethical problem for health officials. Alberta's Chief Medical Officer of Health, Dr. Dina Hinshaw, says it's a dilemma to decide who goes first.
It's an important point that anyone who lives in a setting where what we might term a congregate setting, where there are lots of people living in close proximity to each other, there is a high risk of spread in all of those types of settings, and correctional facilities are just one example. That is part, again, there's the multiple factors to consider when we're looking at phase 2. But again, those decisions have not yet been made, and they will be, of course, challenging. And as I mentioned, we'll have a clear ethical dimension that we need to make sure we're considering.
He goes on to say outbreaks are becoming more common in Canadian prisons and jails. In a news release, it says the government has failed to take measures to stop the spread of COVID. It criticizes correctional services for not isolating newly transferred prisoners, and it adds that not enough cleaning supplies are being provided and prisoners are being refused medical assistance. The society says prisons are poorly ventilated and physical distancing is impossible, and that makes it an ideal environment for coronavirus to spread. It recommends the government allow medically vulnerable and low-risk prisoners to serve their sentences in the community. Meanwhile, paramedics in Alberta pushing to be moved up on the priority list for vaccines. They're not in the first phase of the rollout, but their union wants to make sure they're in the second one. Dr. Hinshaw says, well, it all comes down to risk.
Know that the decisions about the first phase of vaccine were focused on individuals who were at the highest risk of severe outcomes, those who were in close contact with those individuals, and the groups within the healthcare system where there is critical pressures. And again, those identifications of those groups were part of a discussion that involved, again, those risks of exposure, the risks of the worker shortages, and the combination of risks of introduction as well into the locations where those people work. It's really important.
Bottom line, not everyone can be at the front of the line. Well, there's a new face in the front office of the Canadian military. Prime Minister Trudeau has named the head of the Navy as the new Chief of Defence. Vice Admiral Art MacDonald takes over from General Jonathan Vance. Vance announced his retirement earlier this year.
His new role as Chief, Vice Admiral MacDonald will oversee the work of the Canadian Armed Forces, including on vaccine rollout through Operation Vector. The Canadian Armed Forces have been part of the national response to this pandemic since the spring, whether deployed to long-term care homes or helping with contact tracing. I know that Vice Admiral MacDonald's leadership and expertise will be invaluable as the armed forces continue to work around the clock to keep Canadians safe.
Now, MacDonald has been the commander of the Navy since 2019. His appointment comes as the force is dealing with the problems of discrimination and sexual harassment. Outgoing Chief Vance has said there has to be a cultural shift in the armed forces. Trudeau paid tribute to the departing soldier.
Thank General Vance for his service, including as the longest-serving Chief of Defence Staff. General Vance has led the Canadian Armed Forces as they defended our country against military threats, deployed overseas, and protected Canadians at home from everything from floods to now COVID-19.
A change of command ceremony will be held in the second week of January. Still to come, we'll hear from our bureau chief in Hawaii. I've got a sports update for you as well. And if you're just joining us, 19 minutes past 7 o'clock, you're watching Eagle News Mornings from Canada.
Mga mahalagang pangyayari na naganap di lamang sa bansa, kundi maging sa iba't ibang panig ng mundo, ating balikan sa Pilipinas 2020. Tinutukan ng Eagle News Team sa iba't ibang sulok ng bansa, pati na sa ibayong dagat. Pilipinas 2020. Hatid sa inyo ng Net25, Radyo Agila, EagleNews.ph at ng Eagle News Live. Pilipinas 2020. Abangan!
Events happen around us all the time. In our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
This is Eagle News Mornings from Canada. I'm Thomas I. Likeness. 20.5 minutes past 7 in the morning, Monday morning, and we've got about 26 degrees under partly cloudy skies in Metro Manila. In Hawaii, they're doing their best to continue on with reopening plans, and they want to avoid taking a step back, because if you take a step back, more restrictions are in effect. You start shutting things down again. To tell us all about that, Eagle News Hawaii Bureau Chief Alfred Asenas. Good morning and welcome to the program, Alfred.
Aloha, Thomas. And just like in the Philippines, we are hovering close to 27 degrees Celsius. Right now it's sunny, but over this long weekend, we've had our episodes of showers here in Oahu and in other parts of the state. And noted that your Prime Minister offered some precaution about traveling. Nevertheless, look what I got for you, Thomas. I know you know what this is. So this is a chance. Put it in your mind, as an opportunity for a respite, maybe in the new year, huh? Anyhow, you mentioned a reopening. Now, I want to show a chart real quick from last week, courtesy of the City County of Honolulu. Every day, the City County provides a chart in which to track the number of cases on average. Now, but first, here's a shot of yesterday, just yesterday, of a food court in one of Hawaii's largest malls. Now, mind you, the precautions, the guidelines are being implemented despite the crowd that, it's expected because it's a long weekend. And there's another long weekend coming up, in a few days. So you got these folks, residents and tourists taking advantage of this season. Now, and what businesses are trying to do their best and urging the community at large here on Oahu is to stay at Tier 2 conditions. Now, Honolulu provides a daily chart of the daily average number of cases. Last week, we were hovering above 100. It's which actually is part of Tier 1. And thankfully, as of the last couple of days, Honolulu and Oahu Island has gone below that number. So as long as we stay below the 7-day average of 100 cases and below between a 2.5 and 5% positivity rate, we can maintain our Tier 2 conditions. Otherwise, if this keeps going for the next couple of weeks, then the mayor will have to make a hard decision to go back to Tier 1, which, like you said, will involve closing, especially establishments like this, gymnasiums. I know you like to work out, Thomas, so that'll be a frustration for you. Now, and that's what we're trying to do. Now, keeping in mind the numbers that we get are not the actual day of the reporting. There's a couple of days delay. So how the number of cases turn out over this weekend, we'll probably see in early this week, Thomas. Now, I do have also just an update on the vaccination here in Hawaii. We started last week, and there's about, as of the 24th, I believe, 9,000 vaccinations administered, according to state officials. Of course, it's still ongoing, and the priority goes to our frontliners, essential workers. And next one would be those who are residents of long-term care, because those have been known or notorious for being, a source of clusters. So that's where we have the latest for you here in Hawaii, Tom.
Before you go, I want to ask you about Kilauea. What's happening?
Yes. And right now, as of this morning, the crater in that volcano still continues to fill up with lava. It's submerged every now and then, but it keeps filling up, and it's producing a lot of toxic fumes like sulfur dioxide, blowing to the south and western part of the island. Thankfully, you have trade winds coming from the northeast to the southwest. It's blowing it away from the state. So we're continuing to monitor the situation there. But we ask visitors, those living there, take precaution as to the dangers of the eruption. Plus, guess what? We still have COVID-19, and please, do your best to keep yourselves apart and not, contaminate each other. That's all I have, Thomas, reporting from Honolulu. Alfred has sent us. We live in interesting times.
Oh, and if there was any way I could get there in January, I'd be on the first plane out of here January 1st.
This is waiting for you.
I'm looking forward to it. Well, this is unsettling for airline passengers. An Air Canada Boeing 737 MAX, that's the new one that has been grounded. It was flying from Arizona to Montreal last week. It experienced an engine problem that forced it to land in Tucson. Shortly after taking off last Tuesday, the pilots received an engine notification. According to the standard operating procedure for such a situation, they decided to shut down an engine and land. There were only 3 crew members aboard the plane. It was just sort of on a test flight. It remains on the ground in Tucson. The Canadian government announced in mid-December that it had approved the design changes Boeing made to the planes. Now, those planes had been grounded after 2 crashes killed 346 people. They haven't been authorized to make commercial flights yet in Canada. We turn to sports now. Go to the NBA. And, I wonder what is up with superstar James Harden. Is he going to remain a Rocket, or is he going to blast off to another team, as per request from the Beard himself? Let's go to New York, where there's some answers there. And we get them from Eagle News sports correspondent, Tenny Samagi. She has the details. Good morning, Tenny.
Good morning, Thomas. And my, oh my, every season when the NBA starts, there's always some type of ongoing drama. And this season evolves around James Harden, whether he'll stay a Rocket or he will be traded to a playoff contending team. But the Beard started his season debut on Saturday, scoring 44 points and 17 assists in a Rockets loss in overtime to one of the teams that he wishes to be traded to, the Portland Trailblazers.
Some minutes was, felt like my conditioning, could be better, obviously, but it was pretty solid. I think we let one, get away from us. We showed a lot of fight. We came out with a great sense of urgency. You could just tell that being the first game and only basically playing 8 players, took a toll on us towards the end of the game. So hopefully we got to finish this road trip strong and get back home and have our full roster.
We'll have more on the Harden saga, plus more NBA news here on Eagle News. In New York, Tenny Sumagi, Eagle News, we live in interesting times.
$1 million question for you, Tenny. Will Harden stay or leave Houston?
That's more like a dollar question.
That's good. I don't have $1 million.
I don't have $1 million either, but it's very questionable because the Rockets have the say on whether to trade Harden or not. So even if he's requesting to be and demanding to be traded somewhere else, they have the right to do whatever they want. And I'd like to see him stay in Houston just to see how he would mesh with John Wall and DeMarcus Cousins, who are back from their long-term injuries and trying to revive their all-star caliber to be an all-star caliber players. But when a superstar like Harden's not happy, they've got to do something. But I'll tell you one thing, Tom. One of the teams that he wishes to be traded to are my Brooklyn Nets, and I don't want him here. Only because their chemistry right now, it's great that nobody deserves to be traded to the Rockets for Harden.
Thanks for joining us this morning, Jenny, and we'll continue on with the next chapter of the NBA soap opera. That's our program for today. As always, on behalf of our Canadian news team, I wish you all good health. Take care of others. Take care of yourselves. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic and other current affairs. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Stay tuned for Kid Cuento.